So the pressure on emergency departments throughout the UK has been increasing over the last few years, and along with that, with a rise in both the severity of illness and the number of patients who are coming to the departments, we've also encountered a major staffing crisis. The specialty has become much less attractive due to the high pressures and the high volume of work. And this means that in terms of doctors who are experienced enough to make safe decisions in the critical scenarios, we're now pretty light on the floor. We're short of middle grade doctors, and we are also short of consultants, and that's a particular issue here in Wales. One of the issues that we have to try and address is how we can make our departments more attractive to people to come and work in, and there is a certain critical mass that you need to achieve to be able to fulfil all the roles of a senior doctor in an emergency department and not be doing so many nights on call each week that you're getting fatigued and worn out and therefore not able to sustain the job in the longer term. The other issue is that because of the highly publicised problems that there have been in some acute services across the UK, the regulators expect much higher standards of supervision, training and governance now, and that means again having enough experienced doctors around to be looking after the seriously ill and injured patients to make sure they get the appropriate treatment in the right sort of time. The service that they're getting at the moment is not as good as it could be for lots of reasons. As I said, we do have issues with the number of senior doctors around, but also patients are often seeking care in inappropriate places. Most emergency departments in the UK still have over half the work done by junior doctors in their first 1 to 3 years after qualification. They're not trained specialists, and patients tend to come to emergency departments now more than they ever did with primary care related problems, which can actually take the junior doctors a long time to sort out, and often they order investigations which are not the right ones and don't provide the same sort of level of expertise as a GP might. People don't realise that GPs are actually specialists in their own right. And within the NHS hierarchy, they're considered on a par with consultants in terms of their experience and training, and they are skilled in dealing with an awful lot of emergency problems and doing so in a safe and effective way and getting people to the right sort of centres for further care if required. We need to make sure that people use services appropriately. That means their GPs where possible, but also realising the advice they can get from community pharmacies, from other members of the community healthcare teams, district nurses and such, and also from the NHS helplines. We also need to focus our resources for those who are seriously injured in smaller units. There's plenty of evidence from across the world now that having smaller, a fewer number of units delivering the specialist areas of care drive up standards and mean that people get much better and more timely care, and their outcomes are better, more lives are saved, more disability is prevented, people spend less time in hospital if they end up being treated by the right people first time. The fewer the units we have, the closer we are to getting the adequate staffing levels. We have to get a balance between not creating units that become too big or too few and far between, but also rationalising from where we are now. At the moment, we've got lots of units on the brink of collapse, and unless we do something to stabilise those units, then we're going to find we're in a situation of unplanned, unmanaged collapse, which has all sorts of knock-on effects, both in terms of quality and safety of care. The majority of conditions that patients present to emergency departments with do not need highly specialised care. So by providing enough access to care locally for people, the vast majority of people will not have to travel to the more specialist centres. They'll get care more conveniently and more quickly closer to home. There's an awful lot of things that are going to happen which will make Wales far more disadvantaged in terms of the services that it provides. Our recruitment gap is going to get worse. The way we're perceived by doctors in the rest of the UK and in the rest of the English-speaking world will be that we are a failing healthcare system, so recruitment will actually get even more difficult than it is now. we won't be able to attract people who want to have cutting-edge careers in the critical specialties where time is of the essence, and we know that to get a good functioning centre with good results you have to have a certain number of people. If you're trying to spread your services too thin, people won't want to come to those sorts of centres. As a result, we'll find that our standards in healthcare go down. The other thing that will happen is we will get knock-on effects of unplanned closures where we haven't had time to think things through. There is a unanimous voice from the emergency medicine consultants in Wales now that we are in the worst situation that any of us can remember, both in terms of quality and safety and throughput, and we all strongly believe that things have to change to improve recruitment, to consolidate services, to make them more sustainable, and that if we don't do that, then patients are going to suffer as a result.